Waarom behandelen we mentale stoornissen nog steeds alleen met praten en pillen, terwijl de oorzaak vaak diep in onze celstofwisseling ligt? Welkom bij Brein Boost. Vandaag spreken we een absolute autoriteit op het snijvlak van voeding en de geestelijke gezondheidszorg. Nicole Laurent. Nicole is een gelicentieerd psychotherapeut en een internationaal erkende specialist in de metabole psychiatrie. Zij is een pionier in de klinische toepassing van het ketogeen dieet als medische interventie voor psychische klachten. In maart van dit jaar publiceerde zij baanbrekend nieuw onderzoek en vandaag duiken we daar diep op in. We bespreken haar werk die aantonen dat we aandoeningen zoals depressie en angststoornissen bij de bron kunnen aanpakken door de energievoorziening van het brein te herstellen. Is je brein niet ziek, maar heeft het simpelweg de verkeerde brandstof? Luister naar dit diepgaande gesprek met Nicole Laurent. Deze podcast is uitsluitend bedoeld ter inspiratie en kan niet worden opgevat als medische advies.
Today I'm joined by Nicole Laurent, a licensed mental health counselor and a pioneer in metabolic psychiatry. And Nicole, I'm so honored to have this conversation with you today. We are both part of the international Keto for Mental Health group, and I learned so much from that network, and I'm very proud to be a part of it. And this topic is so incredibly important. So thank you so much for being here with me.
Yeah, no, it's my pleasure to be here. Thank you for having me.
Yeah. Okay, well, let's start. You worked in mental health for a long time. And what did you see in your work that made you realize that just talking wasn't enough to help everyone?
Well, so before moving into metabolic psychiatry, I was a counselor for 10 years. I still am a counselor, mental health counselor here in the States. And it was, I think what every licensed mental health counselor or psychologist often sees, which is we do good work, we do good psychotherapy work. My different modalities were things like cognitive behavioral therapy, dialectical behavior therapy, EMDR, behavioral therapy. So things that are considered quite evidence-based and much training in them, very passionate about being good at doing them. And still I would find that I would do some of these therapies and these techniques and, even different type of work also. So someone might say, oh, dialectical behavior therapy and cognitive behavioral therapy, these are more surface level. These are more about skills. These are not the psychoanalytical deep work that people need in order to recover. But, I did work also in things like narrative therapy, which is quite powerful, and doing some of these deeper works. And often I would find that we would work very hard and my client would work very, very hard trying to make these different psychological changes that they felt like they needed to get well. And they would often come back in a week or 2 weeks or 3 weeks, kind of in the same groove of thinking with some of the same issues, even though we worked really hard and they worked really hard. And so for many years in my psychotherapy, I think I was getting quite burned out towards the end there, around the time when I kind of learned more about metabolic psychiatry. I think that I was probably on my way to retiring because it was just really, went through the COVID piece with the constant telehealth and the distress. And I think a lot of psychotherapists, I don't think our field talks about this, but they really do get burned out sitting with people's trauma for long periods of time. And there's really a lot of work that has to be done by the psychotherapist in order to kind of hold that and process that themselves. So anyways, I always was a little bit dissatisfied because I feel like when I went to psychology, school and clinical psychology, I really was excited about human potential. And I was really excited about the concept of people self-actualizing and thriving. And I really deeply wanted to not just see people cope. I just very deeply wanted to see people thrive. And I wanted that for myself as well. And so it wasn't really an instance where I just decided that psychotherapy didn't work. There was always the question of, gosh, maybe I'm not a very good therapist, or maybe the world is just too terrible and too awful and the expectations are too high, right? It was more of I had my own kind of health experience with doing a ketogenic diet, and I noticed the mood effects, and I started to thrive. And then I was very, very cognizant that there is a biological piece that is ignored in psychology, or it's not ours to really manage generally in psychology, but we are supposed to practice from a biopsychosocial model of practice. And we just really didn't have the tools for the bio pillar of competent practice. And so this really just brought everything together for me in my head and made my purpose and what I wanted to do very clear for me.
Yeah, well, I recognize it so much. I've dealt with brain health my whole life. Well, I was depressed on the age of 21, and my mother has depression all her life. My father had Alzheimer, and I recognize the story in my work also as a nurse in psychiatry and dementia. And you told me you started a keto diet on yourself. Why did you do that?
Oh, yeah, I've talked about this in other podcasts, but I had the equivalent of a brain injury due to medication side effects and detoxification that had to happen. And I was quite impaired. Another reason why I would have needed to retire back then is that I had probably stage 1 Alzheimer's type of symptoms. And so I heard Dom D'Agostino talking about it on STEM Talk podcast. And he was saying that it was good for Alzheimer's, and I managed to figure out how to do it on my own, and I felt the effects, and then it's just been going strong since then. So that was the event, and I noticed the mood effects that happened with a ketogenic diet, and I thought that it was really important that I found a way to bring this to my clients, because I felt like it was the biological pillar of my missing piece. Yeah.
Yes. Wow. Okay. So in your view, what are we missing when we ignore the metabolism in mental health or care? You talked about it already, but what are we specific missing? Is it the brain energy or?
Yeah, and where I've landed, that there really isn't a root cause intervention that is not focused on mitochondrial function. So anything upstream, whether it's a microbiome, whether it's hormones, whether it's, nutrition, whatever. I think we have to think about our biological pillar of practice as a true root cause is looking at mitochondrial function, because the mitochondria are actually in charge of absolutely everything going on in human metabolism. And yes, in those pathways, there are micronutrients that are required in order to make enzymes, and the mitochondria do their beautiful work in there. But really, we have to start thinking of it in that way. And when we think about mitochondria, there's all those different jobs they do, but then there's also energy, right? ATP production. And I think that what we're missing, I'm quite enamored lately with a theory that's kind of come out, but it has a decent evidence base, and I quite like it much better than the DSM-5. I think it is much more useful and much more helpful, and actually should be informing the biological pillar of biopsychosocial practice. So I'm probably going to end up having to talk about that more and more. But it's called the allopathic triage theory of psychopathology. It's an excellent paper out, and there's subpapers around it. And what I think we're missing, according to that theory, that perfectly makes sense to me, is that the brain can only make so much energy. It has a cap. It just can't keep going to the moon in terms of how much energy it produces. And that makes sense. And then stressors, whether they are physiological stressors, I would say, like having very high blood glucose constantly and having to deal with the inflammatory effects of that, infection, viral or bacterial, or, poor mitochondrial function, right? If I never leave the house and I never get sunlight and I never tell my mitochondria what it needs to do based on the time, all these different kind of metabolic psychiatry pieces, or psychological stressors, right? And so the whole theory is that if these stressors become chronic, the brain starts to not have enough energy to keep up with the demands of that stressor. And over time, if that is chronic, then that can down-regulate function to parts of the brain that are much more focused on survival. So fear, right? Anxiety, like these types of things. And if you think about it, when we are feeling good and we are expanding out in our world and we are exploring, that doesn't happen from those kind of lower survival ways of thinking, right? And so there's this beautiful theory out there that I think is underutilized to really discuss the biological pillar of a biopsychosocial practice in psychology.
Yes, it's obvious that it's very important. And in your work, you talk also about keto for conditions like schizophrenia. How does changing the body's metabolism actually help the patient to do better in their talk therapy?
Yeah, so serious mental illness, and of course the discussion about which mental illnesses belong in there for sure, but nobody would argue that schizophrenia, bipolar disorder, treatment-resistant depression, those are kind of the top three in which ketogenic diets are being used as a treatment.
Yeah.
Some people would say that they are being used as an adjunctive treatment. And I would say that the people who use them don't think of them as an adjunctive treatment. They think of them as the treatment, and then they are dealing with their medications or figuring what dose they need to be on, if at all, quite frankly. So that's not the straight and narrow definition of it for sure, but it's how people are experiencing it. And so those conditions have really profound metabolic disruptions in the brain and how they make energy. And so ketogenic diets and inflammation, oxidative stress, disruptions of neurotransmitter function. Again, notice I'm not saying just this one pathway with this one medication, we do this thing and it fixes it. Mm-hmm. So there's really profound evidence about metabolism being involved in these serious mental illness etiologies. So what I find, when I went to graduate school, we were told that the primary way that we would use psychotherapy was to keep these individuals on their medication in lieu of what are devastating side effects for them. And that was the extent of which, that was the extent of which I was supposed to play in that field, right? Just get them to stay on their medication no matter what they're experiencing. And that's very different now in psychology. There's different types of psychotherapy that we do with this population, cognitive behavioral therapy for psychosis, for example. There's several really good ones. But what we find is that, I shouldn't say we, because I think I'm the only one, or one of the few saying it. There's a few others that are starting to publish on this, which is if you improve functioning even just a little bit before you ask them to do difficult psychotherapy work like DBT or CBT that have a true cognitive load involved in them, I see better results. And I suspect other psychotherapists would see better results, and other treatment psychologists and other people who do psychotherapy work with this population and others. And so I've actually started to publish around that just a little bit. Trying to open the conversation, because when I was here's the promise, and I've said this before on many podcasts, we were promised that if people were put on medication, they would be able to utilize and be a part of their psychotherapy process better. And in my 10 years before metabolic therapies, that is not what I saw. What I saw is people would be in distress, they would initiate psychotherapy, we would get working, they would go see the psychiatrist, they would be put on medication, and really either the cognitive side effects of that medication were such that they really struggled to do their psychotherapy work, or it's easier to reach for a benzodiazepine than learn a DBT skill. And so sometimes the medications in and of themselves actually would undermine the psychotherapy that their psychiatrist wanted them to go off and get. Or they would suddenly become just fine with whatever it was that was not in place in their life or distressing, and they kind of wouldn't be motivated to do psychotherapy anymore. And they would just say, no, this is fine, And I know that I'm not the only psychotherapist who had that experience with people or who've had that. So I'm feeling like ketogenic metabolic therapy is kind of bringing the promise that was given to us that medications would provide for individuals looking for psychological help.
Yeah, it's important to get energy to go to therapy.
Yes. Yeah. I mean, I was working with people where it was a big win that they took a shower and fed themselves. Like they were really debilitated functionally. And so it's almost silly to ask someone in that state to whip out a worksheet and do a bunch of work around active regulation. Now, I know the DBT people are going to come at me because I know they have very disabled populations doing it. And yes, they can eventually do it and they can do it, but my goodness, wouldn't it be nice to give them just a little bit of a better biological base to do that very difficult, very important work from? A state in which their brain-derived neurotrophic factor is upregulated because of their ketogenic diet. A state in which their arousal goes down because GABA is upregulated as opposed to constantly glutamate. Right? Like, wouldn't it be nice? And I think that, when we talk about people doing DBT, for example, we just often expect that they are coming to the DBT center on meds, and that's okay. Why can't we offer them a ketogenic diet and allow them to pursue their dialectical behavior therapy from that biological therapy practice or biological treatment practice? So just my viewpoints about, I really like to see people get well. And
me too.
yeah, and so I just am really I just really question the paradigm as it is currently, and after doing this for so many years, I just have so much experience seeing the other way works so much better for people that I really just don't feel the need to protect that old paradigm anymore with what I say based on what I see clinically.
Yeah, I agree. And there's so many positive results from keto.
Mm-hmm.
Yeah.
Mm-hmm.
You've shared also a case study about PTSD, right? In March this year. Could you tell us about that study?
Yeah, absolutely. So that was a case report published in Frontiers with a woman who had PTSD, chronic PTSD, well documented, and could not even tolerate the different psychotherapies that were trying to be used in order to treat it, which is not unusual. People with PTSD have very high arousal levels, hypervigilance, and it's very difficult for them to tolerate different forms of exposure and processing. And so while we have a lot of these psychotherapies for PTSD, there is a significant percentage of individuals that either don't derive benefit or just simply can't interact with the psychotherapy modality. So this person had this very high PTSD score, the PCL-5, for example, which is not to diagnose PTSD with, that's a clinician, but it is something that we use to kind of get a feel for their level of symptomology during diagnosis. And she responded beautifully. And what surprised me the most about it was, and this often happens, so people will want individual consultation or they're in Washington State, and so they see me as a licensed mental health counselor for this purpose, and I can't get them in right away. But they hear about this treatment and they just go for it before I can even quite get them in. So what was surprising but not surprising is that as she started to change her diet and started to reduce her carbohydrate intake, she started to get treatment effects. Even before I formulated her ketogenic metabolic therapy for her and she started tracking appropriately. So yeah, she started to, so the baseline that I got for her in terms of her mood assessments, that she was already, I think, 9 to 7 days or something like that into it before we got that baseline. She was already getting some really significant treatment effects that she was reporting.
Okay. And how she's doing now?
She's doing really well now. Yeah.
Yeah?
She's still doing well.
Okay, nice. And I noticed many people think keto is unhealthy because of the fats or it's too restrictive. Or dangerous. Do you notice that too? And how do you explain it that it's actually good for the brain?
My goodness. Well, so I'm very lucky in that the people that come to see me have already decided that they very much want to do ketogenic metabolic therapy. And most of the work I do with them is around them talking to family members and them talking to doctors and learning to self-advocate appropriately. Gosh, the ketogenic diet is so good for the brain on so many levels that, my gosh, that could just be a whole podcast all by itself. There's a huge research literature emerging about all of that. But, it kind of, based on what the person is bringing forth. So are they talking about cholesterol? Are they talking about putting them on a statin? Are they talking about that they're going to get nutrient deficiencies? Like, it really, to answer that question, I generally just listen very carefully to what is the fear or what is the misinformation? And then we just go ahead and talk about that. The cholesterol piece, there's a really excellent documentary that just got published called The Cholesterol Code that I am now sending people to watch before their doctor puts them on a statin. There's really a lot of research evidence to suggest that statins are not particularly good for metabolic health. And so are we going to worry about your cholesterol, or are we going to worry about your long-term metabolic health? And so there's much more evidence, I think, to suggest that poor metabolic health in general, high inflammation markers, poor diet is a much bigger risk factor. And so there's these different things. Ketogenic diets are not well-formulated ketogenic diets of the type that we formulate to help with brain health. These are quite nutrient-dense and do fantastic things for people's health. So I just kind of don't take all that too seriously. I've been on my own ketogenic diet for 8 years. I'm 54. I'm on no medications. I'm in fantastic health. I have plenty of brain energy and pretty good shape. So, and there's lots of people like me like that. And so I just think a lot of these concerns are quite unfounded, truly unfounded, and truly based on a lot of misinformation. And I'm excited about the day when all the educational efforts that are going on in the metabolic psychiatry space trickle down into the medical establishment. And if you have any doctors or people who need continuing education credits, medical education credits, obviously I don't think it doesn't count, I think, in your country, but it's still very good information. There's literally free CMEs, continuing medical education credits that they can find off metabolicmind.org that will help educate them about these things. And I will often recommend my clients to go take those little CMEs. They're not over their head. They're absolutely able to follow along. And then they become much more educated about the topic so that they can reassure themselves, and they're also able to talk to their doctor about it.
Yes, I will put it in the show notes. Yeah, and keto has so much positive effects on the brain, but also for the whole body.
Right, because it's a mitochondrial intervention.
Yes.
It is a root cause intervention. And so many times when we talk about ketogenic diets, people think we're just kind of out there because, how can one intervention help so many different chronic illnesses, and why keto for everything, right?
Because it starts in the mitochondrion, yes.
Yes, so if your
energy.
mitochondrial health improves, it's going to help all of those different pieces all at once. And so it would be silly if it didn't cause a bunch of different improvements all over the body, because really we're not just one system.
I think there is a gap in the research and what actually happens in daily practice. We have to overcome. And in the Netherlands also, it is still very new here. What's your advice for someone who wants to start but a doctor doesn't know about it? Do you have some ideas to help the people more to know about it? About keto? How did you do that in your country?
Yeah, so it's not standard of care here. It's very difficult to find a metabolic psychiatrist here. Okay. There's not very many. We've got Harvard has some, and we've got Stanford has some, and we have some lovely little independent practices all over the country, but it can still be very difficult. And so most of the people I work with in the US and Canada and all over the world, really, they don't have an informed prescriber or medical professional. And you really do want a medical professional available to monitor your medications and adjust them as needed if you're going to be doing a ketogenic diet. There's really a lot of pieces to that. But when people go and they ask their doctor, will you medically monitor my ketogenic diet that I'm going to use? And will you adjust my medications as needed? They often will just say, sure. And that's great because they can be educated as you move along, for sure, as you start to kind of self-advocate for yourself and as you start to learn more. But really, these prescribers are not thinking about the ketogenic diet as its own really powerful metabolic intervention that has medication-like effects, right? So they're thinking, this person has just asked me permission to do like a vegetarian diet or a Mediterranean diet. And those diets don't stop seizures when all other medications fail. Those are very different things than what a ketogenic metabolic therapy is for many people. And so that's okay. You pull your treatment team together. So what we do here in the States, I've helped hundreds at this point. And what we do is we pull together treatment teams. So we have them get a therapist, or often they have a therapist that they're already established with, that they feel good with. And then they have a dietary professional who is going to help them manage their ketogenic diet, formulate it and manage it appropriately for them. And then they work with their prescriber, existing prescriber, or they find a prescriber that they're comfortable with that helps them. And we just pull treatment teams together. And unlike, so I don't do any, and this is a little bit unusual, I guess, I don't do any one-on-one consultation with other people's treatment team. And I do that for a reason, because I have different ideas about what psychiatric recovery looks like and what's involved and what's necessary. And one of those is becoming a powerful self-advocate and being able to articulate why you want to do what you're going to do. And I think that all by itself has a lot of treatment effects. And so, but yes, we just pull them together and hundreds, if not thousands, because I'm not the only clinician for sure. Hundreds and thousands of people have gotten well pulling together treatment teams. I just don't think, I think people are suffering so much. I think that if you put the power in the establishment about when you get well and when they get to approve what you're going to do, I think that's a lot of wasted years potentially for a lot of people. And so my experience is that people don't want to wait. Heck, they don't even want to wait for the appointment with me. They're starting, already. So I think that people can do this without the gold stamp approval of their doctor. And I say, sometimes I'll say, you've been doing absolutely everything your doctor or your functional medicine person or whoever has been telling you. You have been doing it by the book. And how many years you've been doing that?
Yeah.
5, 10, 20. Yes. Is it okay to put that down for now and try something else? Can you give yourself permission to try a different way of doing this?
Yeah. And I have a lot of clients also with depression or schizophrenia. And I always tell them about keto, and I give them information to the describers so they know what a keto diet is. And that's very important.
Yeah, I would say that I love you do that, but I would say the openness of different doctors varies around that. Some of them are going to read it and poo-poo it and whatever, and some of them are going to take it in. And so I think that the patients getting well in front of them is really kind of one of the most powerful things. And I will say that when a patient gets well in front of them and they do not truly acknowledge that or show any curiosity, and just move on to the next person wanting a prescription, I think that it truly does damage to the psychiatric establishment and the relationship that they have with the public. And it certainly damages it for that person who has beautifully recovered using a ketogenic therapy when everything else has failed. There's a lot to process there for people.
Yeah, and is it safe to start keto on your own? You told me that the patients are already keto before they are starting with you, but do you need always medical supervision? Of course, with medication, I think.
That's such a hard question because, Chris Palmer's case, so the way I do keto is very precise. I make them track. Because when people come to me, often they're already on a ketogenic diet and they're not quite getting the treatment effects they were wanting. And so I'm really about fine tuning and getting data and figuring out what we need to do. But there is a very large case study literature of individuals who have put, lifelong schizophrenia in remission, just eating off a low carb food list, right? And you can do that. I don't recommend that, but it's happened for sure. It's in the case study literature, more than one. It's just my only concern is that when people are on medications and they do a ketogenic diet, those medications often need to be adjusted. And sometimes people feel really good on their ketogenic diets and they start to taper down on their medications and they do not do it well or properly, and they can get They can cause rebound psychosis if they're taken down too quickly, if they're not using hyperbolic tapering techniques.
Yeah.
I always adamantly recommend that my clients learn hyperbolic tapering techniques and not 100% rely on their prescriber for their tapering advice. And I know I'm not supposed to be doing that, but that's what needs to happen, because I've just seen so many beautiful recoveries on ketogenic diets be taken off the rails by poor tapering practices. So, the other thing is someone can do a ketogenic diet on their own, and 6 to 8 weeks later, they can start to get these kind of weird symptoms. And maybe they've got nausea, maybe they're not sleeping well suddenly, maybe they are having digestive issues, maybe their anxiety goes up after a period of feeling really good. And they might think that their ketogenic diet has stopped working for them.
Yeah.
When really what that is potentiation effects, possibly from the medication dosage that they're currently on. And if you're not working with someone who's watching out for that for you and bringing that to your attention and telling you to check your side effects lists, then you might go off your ketogenic diet and think, oh, that didn't work for me. Or worse, go to the doctor and say, I'm having these symptoms, and then they add on additional medication instead of titrating you down appropriately. So I think that there is, and I don't just say this because it's my job and I want lots more clients or anything. I think it's really beneficial to have a clinician who is helping you watch for things over, the first 6 months to a year on your ketogenic diet as a treatment. And I think that that's very helpful. And you can totally start to lower your carbohydrates and eat a healthy whole foods diet, for example, before you even meet with a professional. And you can go on a ketogenic diet, but you have to understand that even just the increase of fat intake on your ketogenic diet changes how your medications are metabolized. And so you can start your ketogenic diet, start eating a lot of extra fat, have your antipsychotic medications become more powerful, become more sedated, and then say, that ketogenic diet made me very tired. I shouldn't do it. So you can see it's just an absolute quagmire of considerations. And you can do it without someone like me but I don't recommend it, just because I just see there's so many paths to getting waylaid on your recovery journey.
Yeah, I think it's also important to have someone near you. And if we look 10 years ahead, how do you think metabolic psychiatry will change the standard of care? I hope.
Yeah. Well, I'm an optimistic human, and so my answers are always a little bit are very optimistic. And I say that because I see that when people get well, the people around them notice, and other people want access to that thriving, or that new functioning, or that new ability to be present. Like when they see other people getting what they are hoping for themselves, or have dared to hope for themselves, they will seek out this treatment. And I think it's very much going to be a patient-led advocacy movement, where they are going into hospitals and going into their psychiatrists and just demanding access to this as an option. In a first psychosis clinic, I can see them coming in saying, yes, stabilize me on medication, but don't you dare send me anywhere else other than to a ketogenic dietitian who can help me formulate. I don't want to be on these meds the rest of my life, right? If I don't have to be. So I really see that that people want access to this treatment. And then I think that very powerful patient-led movement that's coming up alongside, parallel to this exploding research base, just exploding. I just can't even keep up with it. Like sometimes I try to write papers and I'll catalog all the case reports and the pilot trials, and they're coming out so fast that in the peer review process that's going on 3 to 6 months, I have to update my manuscript twice with like these new citations. It's just exploding. Yeah. So I think that those two things together, and I just think that I think I'm just not going to stop until it's standard of care somewhere. Do you know what I mean? I don't think retirement's in the cards for me. So hopefully, when I'm 70, by then it'll surely it will be standard of care. So I don't know when this magical number is, this 5 or 10 years, but I really do believe it is inevitable. And I think that if you are a psychologist or a nutritionist or any other type of clinician that has an interest in this, I think it is really a good idea to kind of get trained in being able to support someone on this within the bounds and scope of your profession, because I think that more and more you're going to encounter patients and clients that are using this or want to use it or want you to be able to talk to them about it in an informed way.
Yeah, I think it has to be the first step. And for someone listening who feels like they've tried everything and is losing hope, what's the one thing you want them to know about their brain potential to heal?
Well, I think that I want them to understand that all the other stuff that they have tried prior is not the same as ketogenic metabolic therapy. It is something very different. It is a pleiotropic intervention. And that means that it works on several different pathways. Like I said, it's a root cause intervention. It is mitochondrial functioning. And I just want them to know that I have met so many people who have been told that they are going to have a chronic, unrelenting diagnosis their whole lives. I think that's everybody that comes to me, And I want them to understand that just might not be the case necessarily, that they need to be open to the possibility that might not be true for them, or that their functioning can improve exponentially. I think that when people have chronic illnesses, they definitely go through periods of time in which they don't want to hope or they don't dare to hope. That part of the equilibrium that they have fought so hard for is that how things are now are okay. I am okay. I'm doing all right, and that is enough, and that feels good, and I'm going to stay here for now. And I think that is totally okay. But there's going to also be periods of time in which they do kind of dare to hope a little bit. And so when those periods happen, they're going to allow themselves to expand and consider. And then it's just a matter of educating about it in such a way that you feel like this is a good thing for you. The other thing I will say is that I get a lot of wonderful parents with adult children with serious mental illness that just desperately want their adult children to do this intervention. And I get a lot of requests that I meet with these adult children and I try to convince them to do the ketogenic diet. And really, I want people to understand that this is an adult decision, and you don't necessarily have control over whether your adult child with serious mental illness is willing to do this intervention. And you have to also understand that they've got other doctors telling them that it's dangerous to do something other than what they're doing. So that whole piece about afraid to hope, I think that I don't push them to hope. I know that sounds very odd, because they just might not be ready for this intervention or want to do it or are in a place emotionally to make a big change, and that's okay. I think that it's okay for them to move towards it when they're ready, and they have a much better chance of doing well with it, in my experience.
Well, I think that's a powerful message to end our conversation. And thank you so much for your time and for the groundbreaking work you're doing, and to bridge the gap between metabolism and mental health. It's very important. Yeah. And it's been an absolute honor to have you in my podcast.
Thank you for having me. I appreciate it.
Thank you very, very much, Nicole.
Dit was mijn gesprek met Nicole Laurent. Haar werk en de recente publicatie van maart onderstrepen wat we al langer vermoeden. De weg naar mentale gezondheid loopt via een gezond metabolisme. Wil je de diepte ingaan met de wetenschap die we vandaag besproken hebben? De links naar de papers van Nicole vind je terug in de show notes van deze aflevering. Maar wil je deze inzichten vertalen naar je eigen leven en concreet aan de slag met metabole therapie? Dan help ik je graag verder. Bij het Brein Instituut passen we deze baanbrekende principes dagelijks toe om mentale veerkracht te herstellen. Kijk voor meer informatie over het inplannen van een kennismaking op www.breininstituut.nl. Bedankt voor het luisteren naar Brein Boost en onthoud, je brein is je belangrijkste kapitaal. Geef het de juiste brandstof. Tot de volgende keer.